Welcome to COVID-19, Mental Health Strategies for Coping and Resilience, a seminar presented by Americares as part of this year's virtual Skull World Forum. I'm Jed Selkowitz, Senior Vice President of Communications at Americares, and I'll be your moderator for today's seminar. Before we jump in, I'd like to welcome Wendy Yu from the Skull World Forum Skull Foundation. Wendy?
I'm very excited to join you guys on this virtual Skull World Forum Week event hosted by Americares. As many of you may know, the Skull World Forum takes place each year in Oxford, UK. It brings together more than 1,200 leaders from across the social entrepreneurship, philanthropy, and social change landscape for a week of learning and networking. This year, we were forced to cancel the forum due to the COVID-19 pandemic. Our forum's theme this year is collective strength. We thought there was no better way to reflect that theme than to have our global network design and build a new Forum Week experience together. More than 80 organizations have contributed virtual events to the newly imagined forum taking place this week, including this one. Like many of you, our team is working 100% remotely and adapting and learning through this virtual landscape. We just ask for your patience and grace if we run into any technical hurdles during this session. To follow along with the forum, we are using the hashtag SkullGoesVirtual and would love for you to do the same. In addition to the dozens of independently hosted events taking place this week, we would also love for you to join us Thursday, April 2nd at 11 a.m. Eastern Time for the Skull Awards broadcast, where we'll reveal this year's Skull awardees for social entrepreneurship. You can tune in at skull.org/live. And with that, I'd like to turn it back over to our friends at Americares.
Thank you so much, Wendy. We love the theme of this year's forum, collective strength. For 40 years, Americares' model has been to collaborate with health providers, health workers on the front lines, with NGOs, companies, and generous supporters who step forward to help people in need. For those not familiar, Americares is a health-focused relief and development organization that saves lives and improves health for people affected by poverty or disaster. Each year, we reach more than 90 countries, including the United States, with life-changing health programs, medicine, and medical supplies. Americares is responding to the COVID-19 outbreak by providing personal protective equipment, medicines and supplies for frontline health workers, as well as providing training and technical assistance for health providers and clinical care at Americares-run clinics. Today, we're going to hear from Americares health experts on mental health strategies for coping and resilience. The COVID-19 pandemic is an unprecedented global health emergency, frankly affecting all of us. In this session, we will address how the pandemic affects health workers and the general public. Americares specialists will discuss what each of us can do to address the mental health challenges and stresses that we face, including coping and resilience mechanisms. So let's meet this esteemed panel. Dr. Julie Varghese is Americares Chief Medical Officer and an infectious disease specialist. Dr. Varghese is board certified in infectious disease, internal medicine, and pediatrics. She earned a bachelor's degree in biochemistry from Knox College and a medical degree from Rush University in Chicago, where she completed her residency. Dr. Salvador has more than 20 years of experience working first in the public health and private health sector as a medical doctor, and afterwards designing and implementing health programs targeting low-income populations around the world. Dr. Salvador studied medicine and completed her residency training in Argentina. And later, she completed a surgical fellowship at Cedars-Sinai Medical Center at the University of California, Irvine. Dr. Salvador also earned a master's in public health in the area of health policy and management from the Harvard School of Public Health. Dr. Miguel Marrero manages Americares' mental health and psychosocial support program in Puerto Rico. He holds an advanced studies diploma and a PhD in cognitive psychology with a concentration in emotions and health from the Complutense University in Madrid, Spain, as well as a master's degree in public health with a concentration in health education and disease prevention from Benedictine University. Dr. Marrero has 17 years experience in mental health, public health, and social sciences, and currently serves as president of the Puerto Rico Public Health Association. Boy, if I didn't have enough anxiety as it is, leading this panel of such esteemed experts is going to be a daunting task. Thank you all. All right, let's just jump in. And let's go to the first question. Julie, let's start with you. Can you give us an update on what the coronavirus pandemic looks like today?
Absolutely. The novel coronavirus has practically spread to every country around the globe. And as everyone is probably well aware, the World Health Organization has declared this a global pandemic. I'd say our knowledge of the newest coronavirus continues to evolve, but I think what this outbreak really highlights for us is just how increasingly interconnected our world is. And the fact that infectious disease threats really know no borders. And so it really reinforces the importance of investment in broader health systems, in preparedness, and global health security. To date, we have over 850,000 confirmed cases of COVID-19 infection around the world, with over 40,000 deaths to date. And while the number of new cases in China and other countries in Asia, based on current reports, seems to be slowing down, we're still seeing major outbreaks all around the world, particularly in Europe and here in the US, where we are now the leading country in terms of confirmed cases for COVID-19. And so the topic of mental health in the COVID-19 outbreak is really an important one. This is an outbreak that impacts every single individual in some way. And so the challenge of mental health for frontline health workers and other essential workers is really an important one, but there are ripple effects from this pandemic on every single sector: education, finance, really every single individual is impacted. And so coping and being resilient in the face of COVID-19 is an important issue. And it's really great to be having this discussion here today and to continue to raise awareness on this really important topic.
So we're all facing different types of COVID-19 related fears today in our personal lives, for our communities, and in our work life. I'm curious what each of you is experiencing and seeing on a day-to-day basis. Miguel, given your experience, what's the difference between people's reactions to natural disasters than to the coronavirus pandemic? What are you seeing in the field?
Well, first of all, thank you. As many of you know, Puerto Rico has been affected by natural disaster in recent months and years, such as earthquake and hurricanes, and people experience emotional distress 2 years after Hurricane Maria, and now 2 months after the earthquake. We are still working with people traumatized after losing everything or after the loss of family members. Some common responses to disasters are, for example, feelings of stress, constant worrying, anxiety, fear, change in sleeping patterns, and other depression-like symptoms. However, when we talk about this type of disaster, we are talking about physical and tangible events that those affected can see and understand. And what I mean is, for example, we could see the rain, the storm, we could feel the movement of the earth. But when we talk about infectious disease outbreaks, epidemics, and pandemics, we should understand that it can also bring out strong emotions in people. COVID-19 possesses different treats, and people's reaction have been different, especially because in this case, we are struggling with an invisible and spreading threat, with also with over information and rumors, with uncertainty and especially little control capacity. Here, if you don't have the symptoms, you don't know if you have or don't have the virus. There are also some consequences, even without being a direct victim of the virus, which generate greater uncertainty. For example, you don't see the disease or symptoms, but when you cannot go out to work, you lose the possibility of earning money. You lose control of taking care of the family. Other common fears are the fear of loneliness, fear of rejection, and fear of being disabled by the complication of pre-existing conditions if they contract the COVID-19. In fact, something we have seen during the past week is the fear of lack of essential supplies such as food, among other materials. I think that the most characteristic thing that I have seen in the field here in Puerto Rico, but also in the US, even in Europe, in Italy, is what we saw as like the people, the fear of the toilet paper, don't find toilet paper. In Italy was fear of don't finding pasta. And this is called the fear contagion. We all have seen how fear can be spread from person to person a lot faster than the virus.
Interesting. Gabriela, thank you for, I know we're having some technical difficulties. I'm glad to have you back. Why don't we go to you now? How is the pandemic affecting you and your operations in the field?
Well, thank you and hello to everyone. Almost all countries in Latin America are in lockdown, regardless of the number of positive COVID patients. What does it mean to field operations and actually to operations in general? In Americares' case, we are talking about health operations, clinics. So clinics are allowed to continue to operate, but the combination of fear and tough government restrictions has practically brought services to a halt. Even with our doors open for everyone, only emergency services are effectively active. What we have learned from a past experience with disasters is to place special care in contacting and reassuring patients like pregnant women or people receiving active treatments for conditions other than COVID, that we continue to operate. The fear and anxiety of patients is not just related to the virus, but also of losing access to care in general. We are contacting patients via phone and more massively through our social media platform to provide clear information and support. In terms of staff, as we know, potential exposure to the virus is highest among health workers. And our staff is trained and prepared to deal with infectious outbreaks, but they are painfully aware of the fact that medium, long-term procurement of protective equipment is a real challenge. And that creates a great deal of anxiety because as the spread of the virus progresses, for those that continue to provide services, chances of getting sick will rise significantly. The stress created by the fear of hurting their families, of being hurt, of hurting their families and their patients or customers is very real. And this is true for any frontline worker, from doctors to cashiers at supermarkets to policemen on the street. I mean, the list is really long.
So you mentioned that list of a few people. Can you talk to us a little bit about what the impact is right now on individuals and families in Latin America?
Mm-hmm. Well, as we all know, right, this is a dire situation for everyone. Needless to say that the poorer the country, the more complicated the situation. In most countries, only essential services are allowed to continue, and the movement of people is severely restricted. Given that a significant percentage of people work in the informal sector or are paid by the hour, they depend on day-to-day activities to cover for their basic needs. So a day without work for them is a day without income, and eventually a day without food. And adding to the problem, the quarantine measures were implemented practically without notice everywhere. So that means that people could not prepare for it. In general, there is low liquidity, meaning people are short of cash. Because this is a global crisis, for those countries that rely heavily on remittances, the impact is not just related to a stop in local activities, but also to a sharp decrease in remittances being sent from abroad. So the stress goes beyond worrying about contracting the disease. For those without a steady salary, the situation is getting desperate by the day. And for those with a salary, job insecurity is a very real fear. People are asked to be thankful for their physical health. We all should be. But there is a big need to speak openly about and find ways to cope with various serious mental health struggles at this time.
Julie, let's go to you. How is the evolution of the pandemic and the ever-changing nature of the situation? Everything just seems to be changing so rapidly. How's it affecting you and the work you do specifically as an infectious disease specialist?
It's definitely been tough, and I agree wholeheartedly with everything Gabriella was just mentioning. While the family of coronaviruses has been around for a long time, this newest one is just that. It's novel, it's new. We don't have all the information about it, and it certainly feels like a significant threat. Our understanding about the virus, its impact, how it presents, how it spread, really has grown so much, but there's also been a lot of change in terms of our understanding. And so questions, ranging from how long does the virus live on surfaces to now knowing that people can spread the infection even before they themselves know that they have symptoms. These are real, concerns that our own staff have, and it causes a tremendous amount of anxiety and fear, really. So, we've seen amongst all levels of our staff, from front office staff to logistics to our clinical workers, everyone is, thinking not just of their own health and well-being and mental health impacts. They're also thinking about how their exposure, their behaviors, their risk is going to impact their family members, their friends. Everyone is thinking of their parents or other vulnerable family members who may have chronic conditions. And so organizationally, we've really had to balance the very legitimate fears and concerns amongst our staff, along with, as Gabriella mentioned, national lockdowns and quarantines, with continuing our mission to save lives and improve health. And so where we could, we've adjusted to a remote work environment for our office staff, for our clinical operations and more direct services. We've gone to half-staffed teams. We've also gone to telehealth where we could for our clinical sites. But really, we have felt the effects in terms of our health programming and some of our other clinical operations where, due to national lockdowns, we really had to halt or slow down services.
You mentioned Americares' mission. Americares has been responding to people in crisis for more than 40 years now with life-saving health programming. While nothing in our lifetime may be comparable, can you speak a little bit to the infectious outbreaks and how Americares has responded in the past?
Mm-hmm. Yeah, Americares has a very long-standing history, actually, responding to other infectious disease outbreaks such as Ebola, cholera, Zika, dengue. And our work really focuses on supporting and building capacity of the local health center. We really feel like the primary health clinics are the front lines in their communities when it comes to infectious disease outbreaks. And so in the past, we have provided critical personal protective equipment and supplies. And in addition to training on those supplies, we've also provided training for health center partners on topics like preparedness, infection prevention and control, and also mental health and psychosocial support. We also know from our previous experience that oftentimes in the midst of an outbreak, there's so much attention and so many resources that go towards containing the outbreak. And we saw this with Ebola, that oftentimes people weren't getting care for their chronic diseases. And so people were having complications or even dying from complications of their high blood pressure or diabetes. And so, learning from that experience, we have really, in this particular outbreak especially, really been committed to trying to provide ongoing primary care services to our patient population where we can. And I would add just another important piece when it comes to infectious disease outbreaks that we've seen based on our previous experience is just the important need around disseminating accurate information, really data-driven information. There's so many myths that come out in the midst of an infectious disease outbreak. And so an important role that we've played in the past and in this outbreak is really just disseminating accurate, appropriate information.
So critical. And actually, you were gracious enough to give your time earlier on in the outbreak to do a live stream with me where we were able to help dispel some of those myths, because it's so critical to get information from trusted resources. So thank you for that. Gabriella, you work with professionals who are used to responding to emergencies. How is coronavirus, the pandemic, different from most crises that you typically respond to?
Mm-hmm. Well, in my cases with operation, I think that particular thing that we're dealing with is on frontline workers dealing with patients, as we have discussed, but also on back office workers. For those in charge of keeping the lights on, there is the pressure to find ways to sustain the business with overwhelming external variables that we can't really control or mitigate. That makes it especially hard. Leaders in operations need to make decisions about reassigning resources, adjusting financial and operational projections to different scenarios on the go, and making decisions that include cutting essential services, salaries, and ending contracts in the worst possible circumstances. And the mental stress linked to decision making has never been higher and can be all consuming.
Gabrielle, let's stay with you. Can you maybe talk about how we can help the Skoll community, individual entrepreneurs that are so unique to the Skoll ecosystem begin to think about this? How can we help them address mental health in the era of COVID-19? And how can we in the Skoll community collaborate?
Mm-hmm. For entrepreneurs, mental health and decision making are like tied, right? At this very unique moment. So the situation, and as we know, is unique in the sense that everybody is affected. It is very hard to help others when you're affected as well. And what we have learned from disasters is that the sooner you evaluate the situation, not just at the micro level, like how will I restock my shelves, right? But equally important at the macro level, like US or Europe situation impacted in the flows of remittances to my countries, the sooner you act. And time is of the essence. We have to accept that things won't back to normal in a month, and start making decisions that without question will be very tough, but that can help keep the lights on. It is very important to be strategic now about how we will use or save or reallocate what we have. The sooner we react, the more wisely we will use whatever resources we have available now. And for almost everyone, every single business, the goal is resiliency at this point, at the individual and at the organizational level. So it has to be clear also for everyone, this message needs to be reiterated, that things will eventually go back to some sort of normal. And it is critical for everyone's mental well-being to be reassuring that the community will recover. And at the same time, we have to help our staff, the people around us, build their own resiliency plans in very pragmatic and realistic ways. People need a sense of control, a plan, to be able to function. And even when we know that those plans may change as things evolve, we need to act on a plan. And it is also essential, very essential for an entrepreneur to be very quick to map what other organizations are doing. This is as important as adjusting your own operations. Another thing is collaboration between organizations. Sharing information and pooling resources is essential, and it's not just for operations, but also to communities, for those that we serve. Another thing is public-private partnerships. Those have never been more important as today. A disruption of this magnitude is not only affects the health system, but all of the economy, and cannot be fixed by one sector or the other. We need to act jointly, and that means not just top-down interventions, but also community-led interventions. And in this audience, we have representatives from all sectors, and there is no one sector that has not been affected. So we need to confront this together. And we need to break silos, and we always say that, and it sounds so cliche, right? But it has never been more true and real than now. You learn the most from those that are looking at the same problems from different perspectives. We really need to listen to each other.
Right. Julie, let's go back to you. What we're seeing in some communities in the US is an event that our healthcare system and health workers who run it have never experienced. I mean, we're seeing video appeals on social media, health workers, absolutely breaking down, and with good reason. As a practicing physician, can you speak to the mental health impact of the pandemic on these heroic health workers?
Mhm. Yeah, it's a really tough issue and an important one to talk about. I think, certainly, like we've said already during the course of this discussion, we're in an unprecedented time in the US and in many countries around the world. Compared to natural disasters, I'd say, where there's a more finite time period around the acute threat. With infectious disease outbreaks, the timeline and trajectory really is unclear. And that's the state that we're in right now with the COVID-19 outbreak. And so there, is such a broad group of people that are continuing to provide care and other services that are impacted themselves. When it comes to healthcare workers, I have heard from multiple physician friends and other healthcare workers that for the first time in their careers, they're genuinely scared, in terms of providing care while also being concerned about their safety, their family safety. And, these are our healthcare workers that have been through other disasters and other infectious disease outbreaks. Here in the US, we are faced with significant shortages of personal protective equipment, also critical equipment like ventilators. And people are being forced to make really tough decisions about how to allocate resources for an overwhelming number of patients that are coming in with COVID-19 infection. I would also add just, for those on the front lines and thinking about themselves and how their exposures and risks impact other members of their family and communities, some healthcare workers have made the really tough decision to live apart from their families during this time until they know that their risk is less, and that is for the foreseeable future. So when you think about going into work each and every day and dealing with the stress and the strain on the job, and then coming home and not having the support of your family or your friends, that just further adds to the mental health impact. One other piece just to add is that because this particular outbreak impacts every single individual in some way or another, we're also really feeling the shortage of mental health and psychosocial support specialists, particularly internationally. There's such a huge need in terms of mental health support during this outbreak because of the significant number of people that are impacted.
Great. Miguel, this is really your expertise and also an area where Americares has focused, particularly in recent years. Can you talk about what specifically Americares is doing and has done as part of our health programming to help health workers preserve their mental health, especially during times of crisis?
Sure. I want to begin this answer repeating something that I just read that Gabriela mentioned before, and that is that it's very hard to help others when you are affected as well. And when we are talking about these situations, we should mention that they are affected physically. They are tired, they're getting tired, they don't have resources, but they are also afraid. Americare intervention strategies such as capacity building in mental health for this personnel before emergency events, and I mean like trainings in resilient development, in stress management, and crisis intervention strategies. But on the other hand, we have support interventions and crisis intervention during the emergency, where our mental health professionals reach the affected areas and give direct one-to-one support to those health workers and responders. To give an example, let's take this case, the COVID-19. Right now, psychoeducational workshops are being carried out through online platforms to educate them on different topics relevant to mental health, such as infodemic, anxiety and stress, coping, managing quarantine and isolation, and psychoeducation for vulnerable groups, and among other topics of interest. During the workshop, we seek to offer the participant adequate and updated information on what is related to the virus, but especially on what is happening emotionally to them and to their patients. we explain how the body behaves and how the mind reacts. We seek to offer in those webinars and workshops cases and examples so that the participant can identify themselves. At the same time, they can understand how normal their reactions are and what tools they can use to work with these situations. In the COVID-19 workshop, we have had very good reception. As close as this week, I received a call from a Colombian health worker who participated in one of our workshops and told us how much it helped her to manage her fears and also requested these services for the health personnel in different parts of Colombia. They are currently managing COVID-19 patients in their clinics. It is really satisfying to know that we can help by offering useful tools for the participants and for their patients. Among other initiatives, following the Interagency Standing Committee Reference Group of Mental Health and Psychosocial Support in Emergency Settings, in Americares, we also have been working in areas like, for example, strengthen the mental health and psychosocial support coordination by facilitating collaboration between our organization and different government and public agencies. And that collaboration was the one that Gabriela was mentioning. An example is we have been here in Puerto Rico, Americares in Puerto Rico have been in partnership with the Mental Health Agency. We have also, as Americares, integrate mental health and psychosocial considerations into all response activities that we are doing. And also ensuring that accurate information about COVID-19 is readily available and accessible to frontline workers and to the community. And Julie has been a really important piece in that process.
So let's talk about that, Julie. Miguel gave us sort of an overview, but do you mind going a little bit deeper around these workshops? Because maybe some of them are replicable with organizations that folks who are tuning in are part of.
Sure, happy to. And Miguel's being way too modest right now. He and his team, as well as our Texas mental health and psychosocial support team, have done tremendous work. And we've gotten really great feedback from all of the participants that we've been working with, including our own staff on our initial COVID-19 mental health work. As far as some of our previous workshops, just to add to what Miguel has said, we've also done a number of smaller focus groups where we've had smaller groups of individuals, again, those who are on the front lines across various sectors who are impacted themselves, bringing them together to talk about topics like mindfulness, stress management, coping, and resilience. And so while providing them with skills in each of these topic areas, also giving them the forum to come together and share their personal reflections and challenges. I also just want to highlight another training program that we've provided, and that is psychological first aid. We've trained individuals across various sectors, not just health, education, other social service institutions, on psychological first aid, which is an evidence-informed training program that really teaches lay people, so not folks who are specialized in mental health services, but your average non-mental health focused individual. We teach them to be able to identify folks in distress, so fellow work colleagues, community members, family members, and friends, to identify when there are signs of acute distress, and then be prepared to provide some immediate crisis intervention and to be able to help mitigate that acute distress.
Miguel, you spoke a few minutes ago about coping strategies. How can our audience and the general public adopt those strategies? Are there certain coping mechanisms we can all use to help manage our anxiety and stress?
Yes, there are. But first, we have been mentioning coping during this activity, but I think we may begin by defining the concept of coping. And in psychology, when we talk about coping, we refer to the use of strategies or to invest one's own conscious effort to solve personal and interpersonal problems in order to try to control, to minimize, or to tolerate stress and conflicts. The psychological coping mechanism then refers to adaptive coping strategies which reduce stress. And there are many different strategies that you could try. For example, one of the most important is breathing. And we could mention different strategies of breathing, but just concentrating in how you're breathing, because deep breathing is one of the best ways to lower stress in the body, because when you breathe deeply, a message is sent to your brain to calm down and relax. As you breathe deeply to relax, those things that usually happen when you are stressed, and I mean such as increase fast breathing, heart rate, high blood pressure, all decrease. Another coping strategy is to connect with others. Talking about feelings is something we know is an important part of crisis management, and also psychological first aid that Julie was mentioning before. So why can we take advantage of that? Let's call our loved ones and tell them how we are feeling right now. When we share our concerns and our emotions, we help to process what has happened, reaching new conclusions and ideas instead of staying in that circle of the problem. On the other hand, we avoid running away from from reality, so that the negative emotion descend and the mind can assume the movement toward possible solutions, alternatives, or ideas. Other effective coping strategies are physical activity, doing exercise, also to participate in support groups, and you could use different social medias, like for example Facebook, uh, for that. And there is evidence that the use of art and creativity have been very effective. Certainly one way to cope is to seek for professional help. There are certain signs that we may mention right now of when to ask for help. For example, lack of sleep or appetite, permanent sadness, isolation, distancing from contact with other people, or even thinking or verbalizing about suicide, or the desire to die.
Wow, amazing tips. And actually, although nobody wants me to do any art, I certainly am trying to put some of those things into practice, like working out and walking, and staying connected to friends and loved ones. So thank you for those tips. What we're
Sure.
facing now is really unprecedented. I mean, it's just incredible the amount of social isolation that we currently have, for good reason. But it's totally new and unique to us. And it can be particularly confusing and stressful for children. Do you mind talking a little bit about ways that we can help children cope too?
Sure. By the way, one of the webinars that we have developed as MHPS's team is directed for children. And in this webinar, our fellow psychologist, Dr. Ibelis Morales, suggests some of the things that I'm going to mention. For example, to avoid excessive information, limit the access to news, or to avoid confusion and to keep fear from increasing. The best is for the adult to explain the information to the child. The other thing is stay connected, motivate the children to talk maybe on WhatsApp or with another application, and that allow them remote connection. They can make video calls, phone calls with family or friends frequently. The adult can actively, of course, participate in these calls, and especially if the children is really young. This makes physical withdrawal not so hard and allows emotional close-up. A very important part is to establish routines. Planning each day will help them, the kids, to feel more stable in the midst of uncertainty. Establish a time, for example, to get up, to go to bed, to do the homework, even to play. Of course, always being flexible. Another thing that is really important, and we mentioned before for adults, is to promote daily physical activity. Also, we suggest to support the elderly. Ask the children to call or communicate with their grandparents or elderly people. This gives emotional support to the elderly and a sense of utility to the child. Another thing that I could suggest is to promote positive attitude in children. Bring them the message that this situation is temporary and that will pass, and that it will be better to face it in a good mood. Other areas that can be useful with kids is, for example, taking them to help at home, sing and dance with them, even motivate them in their creativity by drawing, painting, making songs, and even playing with them.
Amazing tips. And frankly, as you alluded to towards the end, a lot of things that parents can do with their children. And I think probably while they're helping their children to cope, I'm assuming will also be helping the adults cope as well. So thank you for that. Gabriella or Julie, do you have anything to add?
I'll just say that I really appreciate all of those tips from Miguel as a mom of 3 young kids myself. So definitely will be using some of those strategies. I also just really want to add, just to reiterate what's already been said, it is so essential to focus on mental health impact right now to help mitigate some of the longer term consequences. We know there are going to be longer term consequences from this outbreak. There is going to be such deep personal loss felt by so many as a result of this outbreak, whether that's economic or health. We're going to see impacts from social distancing and isolation. And as Miguel already mentioned, kids out of school, some for the rest of the school year. And so we're going to see longer term consequences coming out of that. And I also just want to highlight that we know that individuals with underlying mental health conditions tend to do worse in the face of crisis and disaster. And so we really want to think about that population of individuals as well. And also our chronic disease patients, they may not be getting all of the care and services that they're used to getting or may require in the context of this outbreak. And so there can be other mental health challenges and well-being impacts from that as well.
Right. That's a great point, Julie. It may seem like a long way off right now, but at some point we will be turning towards recovery. So I'd like to talk a little bit more in a hopeful way about the aftermath of this crisis. Gabriella, what do you think the impact of the pandemic will be when things go back to normal for most people? How will this impact health workers and the health system overall?
Well, I would try to be the bearer of great news. This would be a long healing process, right? I think that, in my opinion, at the global level for everyone, there will be a deeper, much more real understanding of the risks and the consequences of having weak health systems and the strain, of course, this can have on our health workers' mental well-being, right? And there has been a lot of reluctance to invest more broadly on health systems, mostly, I think, because the risks of neglecting it were grossly underestimated. And so hopefully there will be more proactive investment, and even voters will ask for that. And I also think that there will hopefully be a more intentional and collaborative approach to global health. Country borders are really no protection for health risks. And so we need to act together. And this cannot be partisan. And there will be, I think, a better understanding of supply chains and new ideas about how to strengthen them. And on a small, brighter note, people's knowledge, attitudes, and practices when it comes to hand washing, and infection prevention in general will forever be changed by this event. And that will have a very positive impact on prevention of the spread of this and other infectious diseases, hopefully.
Yeah, I think you're right. And I appreciate the fact that you've closed there on a very positive, uplifting note. I think there are going to hopefully be some good things that do come out of this long term. Miguel, can we talk about the long term a little bit? What do you think the long-term mental health impact from this crisis will be on the general public?
Well, this is tough. I think that we have not seen the level of this pandemic as such a traumatic event, at least in the recent history. This pandemic could cause long-term emotional trauma without precedent on a global scale. And I mean that no catastrophic event that we have experienced in the past decade has generated this great snowball that we have experienced with the COVID-19. In the same scenario, we have millions of people fighting against an invisible threat or a mass disaster, adapting to a quarantine and accepting the loss of their work or earnings for a week. And to this, we should add hundreds of thousands that have been infected, thousands that have died, and that the virus continues to spread. This situation could leave millions struggling with psychological disorders for a long, long time. One of my main concerns is that this phenomenon has caused the community to deal with the feeling that they or their loved ones are suddenly physically vulnerable. The nature of this disease is one that there can be no certainty about when the worst will happen. And this could generate something that I haven't heard other people talking about this, but it's the learned helplessness syndrome in the population. When I say learned helplessness, I mean when an individual continuously face negative, uncontrolled situations and stop trying to change, they learn to stop trying to change their circumstances, even when they have the ability to do so.
Interesting. Miguel, let's stay with you. Is there anything we can do now to build our resilience?
I think that's the point. That's the main point you just mentioned, resilience. And in psychology, when we talk about resilience, it's the ability of a person to overcome a traumatic circumstance. It is an aptitude adopted by some individuals who are characterized by their posture when overcoming adversity and high stress in order to think about a better future. In a recent conversation with one of our mental health specialists from Texas, Lisa Ledoux, we discussed that the keys to resilience were what she called the 3 C's. These are connection, communication, and control. When we talk about connection, we talk about contacting others. During these weeks, we have been making people aware of physical distance as a health measure, but that does not imply a social separation. Human beings are gregarious beings by nature. Therefore, that contact we may have with the other is part of our process of develop resilience. Therefore, sharing with the family board games, calling those who are farther away, sharing with even with our pets are very healing forms contact. The other C is communication. To talk about your feelings and emotions, as we mentioned before, talking about how you feel is in itself a way to heal. A key point for resilience is to develop communication, the sharing of emotion using creative forms such as the internet, phone calls, chats, but concentrating in talking about how you are feeling your emotion and what to do to get better. And that what to do is the third C, is control, is self-efficacy or empowerment. One of the ways to immunize against learned helplessness is precisely by teaching the person that they do have control over their decisions and their problems. Therefore, help them to have experiences where they can make decisions and understand that although we cannot leave our houses, for example, we have control of our space, of our time, and on our decisions.
Julie, we have a question from the audience about Americares' current response to the COVID-19 outbreak. Would you mind speaking to the current focus of our work and how it may evolve over the course of the crisis evolution?
Sure, happy to. Americares' work for the COVID outbreak really has 3 tiers. The first is really to continue to source and distribute critically needed personal protective equipment and other supplies to healthcare facilities, both domestically but internationally as well. The second tier of our work really is focused on kind of what we've already been discussing in this panel, and that's helping partner health facilities and other organizations on capacity building and support, particularly in the focus areas of mental health and psychosocial support, infection prevention and control, and also facility preparedness. And then the third is just business continuity, and certainly that piece will definitely have to be flexible as we continue on in this outbreak, whether it's regards to staffing challenges or continued quarantines. But we really are continuing to do as much as we can in terms of providing clinical care services, adapting our health programming to continue and being innovative about how we're approaching that, whether it's more remote trainings like we're doing with our webinars, Americares and our more COVID-specific training programs. But really, we're going to have to continue to be flexible and adapt throughout the course of this outbreak with all of our work.
Great. Well, thank you, Dr. Varghese, Dr. Salvador, and Dr. Marrero for contributing your expertise to today's session. During these stressful times, it's so important to have expert perspectives and strategies to cope. We opened up the stream with the theme for this year's forum, Collective Strength. It's only through the collective strength of all of us that we can get through this crisis. It's our model and core to our purpose at Americares, to collaborate with extraordinary NGOs, corporations, entrepreneurs, and foundation and individual donors to bring good health to more people, particularly the most vulnerable in the United States and around the world. We want to hear from you. There are so many amazing people tuning in today who have entrepreneurial ideas to help solve unprecedented challenges like the one we're facing with COVID-19 and future outbreaks. If you'd like to contact us, please send an email to info@americares.org. That's info@americares.org. And if you'd like to learn more about Americares' response to the COVID-19 crisis, please visit americares.org/coronavirus. Thank you for joining us today, and please stay safe and healthy.